William Ruto is not new in town and is not new to Kenyans, the way he's operating. And he has not changed his agenda at all. What he promised Kenyans is what he's working on. It is now time to work, not to talk. And the bottom-up economic transformation agenda is the philosophy of the president. And when he established the broad-based government, he said, I want a broad-based government that is all-inclusive to help me deliver my agenda, the bottom-up economic transformation agenda. The critics and pundits can try and criticize, and that's allowed. We are a democratic country. But then Kenyans can see what has been done without talking. If we talk about universal health coverage, has a lot of work gone into it? Yes. There are 4 pieces of legislation that are being implemented. Primary health care facilities are delivering. The level 4, 5, and 6 are implementing the shift policy. Levels, the critical illnesses are being handled. And in fact, from 1st of December, the cancer patients are being now treated at 800,000. And since independence, critical illnesses have never been handled. No insurance has ever handled that. So if we go into the details of implementation of health plans to make UHC work, a lot has gone into it. And we would like to be told of any patient in Kenya, any citizen who has gone to a health facility to be treated and has been turned away. I have been monitoring the implementation of SHA program on teachers. And there's a lot of excitement. Anybody can check.
Excitement or resentment?
No. There's a lot of excitement. In fact, for those who are going to get treated, you know the problem with the health care, those who talk a lot are people who are healthy who have not even visited the facility. But those who give good accounts are those people who have been sick.
But Honorable Sossion, reality is that also those that are selling us the SHA agenda do not visit these hospitals, to access, like he says, most of these leaders, their children are in, British curricula and other curriculums. The same people will travel abroad to seek medical care as opposed to utilizing.
We might require another whole week to discuss why some Kenyans are going out for treatment. In fact, the philosophy of UHC is that everybody will have to be treated locally once we improve our healthcare system. And he has talked about apologizing on behalf of Singapore and the rest, forgetting that the Prime Minister of Malaysia was here and he congratulated the President on the issue of housing. President William Ruto was recognized at the UN on the matter of housing. So I've talked about healthcare. A lot of work is being done. It is work in progress. It will work. And I've been in that space for the longest. And I give a lot of thumbs up on that one, because what is so great done, having all Kenyan households being treated at the cost of the resources of our own country. Housing, Linda, if there are constructions in over 170 sites in the country, and we have seen Kenyans moving into the housing, is that not work? And we've seen construction of markets infrastructure, hostels around institutions, and including schools, facilities at Mukuru, for example, which was handed over the other day to the ministry. Is that not work? That's commendable work. It is bottom up. ICT infrastructure, the connectivity of the ICT high speed has gone to over 20,000 kilometers.
And that's for the government.
Very phenomenal.
Yes, that's for the government to tell us.
The work in agriculture sector.
I want to take it away from you.
I want to take it away
from you and to Zachary, because he wants to respond.
Guaranteed minimum returns. Are the coffee farmers not earning almost double? There's a lot of work being done. It is work in progress.
Fair enough. It's for the government. Honorable Sossion, you have got to be fair and understand that there are the three of you here. Yes, Zachary.
The president is going to be re-elected on the basis of the work he has delivered.
It's a question of wait and see.
Let me just say something.
Yes.
See, that